releases we see probably averages about 36 milligrams of like Concerta. The main thing to know is that like 5 milligrams of one isn't necessarily equal to 5 milligrams of another.
Right.
So each one's going to have different potencies. But yeah, definitely tailored to the individual. Like I said, with most of these, you want to start at a lower dose initially, and then over time, slowly go up until you see the symptom relief that you're looking for. And those needs, most prescribers around here are really great about reevaluating those needs. But as the kiddos grow and their bodies change, some of those needs might increase, some of them might decrease. That's another one of my things with some of these medications is some of it might just be seasonal, not seasonal, say like allergies, but say you had a tough time, a traumatic event, for example. We'll get to some PTSD in a minute, but traumatic event, and so you need this antidepressant or anti-anxiety medication for the first couple years after that. Well, then you might look at even stopping that medication or going down on the dose to see if you still need it. Sometimes over time our wounds can heal mentally and physically. So that would be something I would say needs to be reevaluated at least annually.
That's a good point. And one of the things you and I talked about yesterday is that a lot of the times our kids are at a residential treatment center. They may not be right here. They may have multiple prescribing physicians. On my case in particular, there are 2 different prescribing physicians. And so when we have questions about whether their dosage needs to be reevaluated or whether it's more that seasonal that you were talking about or whatever, they can go to a pharmacist and ask some of those questions. It doesn't have to be the prescribing physician, correct?
Correct. Yes, we are some of the most accessible healthcare providers out there. I would, of course, recommend going to a community independent pharmacy like ours. You're probably going to get a lot better customer service there. The pharmacist has a little bit more time to stop and talk with you than the poor guy at Walgreens who's just overrun, overworked. Great folks work over there. I got some great friends that work at all the chains, but I know their workload as well. And so I feel like it's important to have somebody you can talk to, you can trust, you can develop that relationship with. And so yeah, if you get your medication somewhere and say kiddo's not getting it at the same place because they're in a facility of some kind, yeah, ask your pharmacist. If you're there picking up an antibiotic or something, feel free to just say, hey, I have a question about some medications that about a kiddo that I know. Or you may call them and let them know, hey, I'm going to be in later for some time to discuss, because sometimes it takes a little bit of time to gather and get all the medications and everything. But yeah, that's certainly something that your pharmacist can answer.
Great. Okay, any other questions here before he moves on? Jane asked, in general, do you get the sense that children now are more over-medicated than they should be in general, or do you think it's handled appropriately?
I'd say that depends. Depends on the kiddo, depends on the circumstance, but I feel like our society nowadays is very quick to take a pill for something. You think back to before we had all these medications available to us, and what did we do? If you had one of these conditions, you might not have been diagnosed with it, but you just kind of pull yourself up by your bootstraps and power through. And I say that not to take lightly these conditions, but I feel like some pharmacy, I read Deborah's question, I saw pharmacy. Some parents are really quick to just say, hey, fix it, give my kid a pill and chill them out. I don't think that's the approach we need to take. That's why a lot of the guidelines recommend the behavioral type therapies, things like that first, and then we can go into medications. But I guess to more directly answer the question, yes, we might be a little bit over medicated, but again, I think we're just quick to jump there.
Okay, and then 2 more questions, then we'll get back to it. Someone asked about the difference between brand names and generic.
Yes, so brand and generic, there are some medications that brand name might work a little bit better on. And again, like we see that mostly with like thyroid, some of the hormones, not necessarily what we've talked about here, but the FDA, whenever they make a branded generic, the generic company, as long as they can prove that it's the exact same molecule as the brand name, then they can make it cheaper. Because if it's the exact same molecule, it's already gone through all the same safety testing, the efficacy testing to make sure that it works. And the big company like Pfizer, for example, they've already dumped billions of dollars into that safety testing and efficacy testing. And so these generic companies just say, hey, I have this same molecule here. Why should I have to do all that work? So the FDA says, sounds great. So they can sell it a lot cheaper. But no, they're exactly the same thing. They might have certain fillers in them that are different that people might not tolerate as much as others. And some prescribers too can look and see if they've had patients have better luck with certain brand names versus generics. But if it were me, I'm going to take the generic medication because it's more affordable for me.
And they can talk to their pharmacist about those things.
Absolutely.
Okay. And then the last one was they asked if you take Superior Health at your pharmacy.
Yes, we do take Superior, take all branches of Medicaid. I'm happy to work through that with you. If you have any questions, give us a call. I will say state Medicaid is a little harder to deal with. Sometimes they mandate that you have a brand name, that they mandate you have a generic, and that's a whole different conversation about why that's not okay. But you can talk to me about that later. So yeah.
Okay, well, let's get back to your presentation and we'll do the rest of the questions then.
All right, sounds great. Get this pulled back up here. Nope, wrong one. There we go. Okay. All right, so the rest of this is going to go pretty quickly. I know we're probably about right on time. So let's talk about some behavior and mood and PTSD just really quick, not as in depth as we talked about anxiety and depression, because again, a lot of these conditions are related to each other, and we're going to treat them very similarly. I don't know, it says my screen sharing is paused. Can you still see that, Rebel?
I can see the slideshow, yes.
Okay. Okay, perfect. Okay,
Sorry,
so lots of behaviors modeled after what children have seen. And if you look over here on I always do that. I don't know why I do that. I'm so sorry, guys. Right here, I have a little picture of a sponge because children are like little sponges. They're going to absorb whatever is put into their environment, whatever behaviors that is, habits that is, because kind of monkey see, monkey do type thing. Y'all probably learned about all that kind of stuff being involved with CASA. I'm sure that's something y'all talk about. So if they see some kind of harsh or inconsistent parenting, or if parents have mental health conditions, the kids are going to be subject to that. And they're going to think that's normal because they don't know anything else. And so if parents have mental health conditions like substance abuse, depression, or ADHD, sometimes that, by way of the environment, kind of gets passed on to the kids as well. PTSD, so there's been a trauma happen, and then now you have an issue with that trauma, either similar circumstances or when the body gets kind of stressed out again, it kind of just defaults to that traumatic event. And so usually what we like to do here for treatment is trauma-focused psychotherapy. So basically learning how to deal with the trauma and accept how that happened and working through that. That's all way above my expertise. That's therapists and things like that. Also cognitive behavioral therapies. SSRIs, again, coming back, can be used. So like citalopram, sertraline, any of the SSRIs can be used to help with PTSD. So I know that Teresa asked some of you for some medications you might have some questions on, and so I figured I'd throw some of those in here. If you have any specific questions, again, feel free to ask. If we don't have time today, feel free to contact me. We can talk more about them if you had deeper questions. So one big medication that we see a lot for used in ADHD and depression and things like that is Abilify. This was first kind of made as a drug to go along with an antidepressant. It was kind of like an add-on that helped the antidepressant to work better. So its generic name is aripiprazole. And as you can see here, it's used for a whole bunch of different things. I would show you guys kind of how it works, like we talked about with serotonin with some of the antidepressants, but the description of how it works is literally like that long. So just know that it works on a bunch of different hormones and neurotransmitters in the brain to help accomplish its end goal of helping you feel a little better. So some side effects, the biggest side effect is that it can alter our cholesterol a little bit. So it can make our cholesterol worse. In kind of a summary statement, it makes our cholesterol worse. So that'd be something that the doctor would want to monitor. It can cause weight loss and weight gain. It just kind of depends on the individual. It can cause some constipation, some drowsiness, some dizziness, and also some temperature regulation issues. So very similar to what we've seen before with the antidepressants, temperature regulation, drowsiness, and dizziness. So because it's working on very similar parts of those pathways. Hydroxyzine is another drug that can be used for anxiety. There are two forms of hydroxyzine. There is a hydrochloride version, and there is a pamoate version. I'm going to try and spell that out. Pamoate. Sorry, guys, I'm trying to write this out with a mouse. So pamoate is another version. But so it can be used in anxiety. It's got some limited use. That doesn't mean that if you know somebody who's taking it or if your kiddo's taking it that it's wrong. It just has a little bit more limited use in anxiety. There's also these two medications, oxcarbazepine and zonisamide, or trileptal and zonegran. Those are mainly used as like anticonvulsants in epilepsy and seizures. If you or your kiddo's taking this and you're like, but I don't have seizures, or they don't have a history of seizures, that's not necessarily a bad thing. Sometimes, depending on what the prescriber has seen and certain case reports, you might see that this works well to go along with some other things that we have that we're treating conditions for. So, but that's mainly where those medications are used. So we're going to get into some drugs of abuse next. We're going to talk mainly methamphetamine and cocaine. So methamphetamine is a stimulant. So we talked about stimulants before and how those work. That can cause like a high type effect, a rush, and it's very highly abused. You probably know that. So more than 400,000 reproductive age women reported using meth, and the month prior when they were asked about it on an emergency room visit. There's quite a few people in this small sampling that actually said yes. That's another thing that we have issues with in healthcare. You ask somebody, do you drink or smoke? No, because they know that's the right answer. So 400,000 people said, yes, I did. They were honest. So that's still probably underreported. Some negative health effects of meth are that it can cause a rapid heart rate, sweating, high blood pressure, hyperthermia, seizures. Again, it's a stimulant, so it's going to get in the brain and stimulate all those processes. In pregnancy, it leads to a lower BMI. So you see a lot of people, pictures of people who have taken meth, like on the news or on the internet or something. Their face is all sunken in. They have like no meat on their bones at all. So imagine trying to have a baby thrive in that environment when the person themselves can't thrive in that environment. So really, really stressful situation for everybody involved if meth is on board. So restricted intrauterine growth for a baby, and then it also reduces placental blood flow, which can lead to fetal hypoxia. So if there's no blood going there, there's no oxygen going there, again, makes it a very stressful environment for life to thrive. So some direct effects on babies. They could have a low birth weight. During the prenatal period, they could have a small size for their gestational age. So say you're 20 weeks, you might be measuring like 15 weeks instead. So We don't like that. We like things to go on track how they're supposed to. Increased risk for neurodevelopmental issues. So all the brain's not forming correctly, those neurotransmitters aren't forming correctly. It can cause, once the baby's here, can cause an excess irritability and crying. They have poor self-regulation or feeding, and their sleep and wake cycles all messed up, and tremors as well. So basically, once the baby's here, if there was meth on board or any sort of illicit drug on board, we'll get to cocaine in a minute, but if there's a consistent stream of alcohol or marijuana or anything, and now all of a sudden the baby is removed from mom's blood flow, that level is just gone to nothing. Like we just talked about with the antidepressants, why you don't want to just stop them cold turkey, because you'll have withdrawal type symptoms. That's exactly what's going to happen to the baby once they get here and that blood supply is cut off, because now they don't have that level of drug in their system as well. And these withdrawal symptoms can occur for months. And it's just so heartbreaking to hear about these stories. And I know that you guys, and God bless all of you for being so strong to volunteer your time and efforts for this population of people. CASA does a great job about making sure that they train you guys correctly and everything, and understanding all this. So it's very much appreciated from the bottom of my heart for y'all's time and doing things like this, because it's just so heartbreaking when that happens to these kiddos. So some withdrawal symptoms that can happen are difficulty with transitions or changing in their environment, discomfort with body sensations. So if they have a bowel movement, or if they're getting dressed, even the clothes on their body could cause them to be agitated. Bathing them, they're extremely sensitive, they have neurological impairments, and they have really hard times being comforted because they're going through withdrawals. So what you might do for a normal kiddo that hasn't been exposed to this might not work for these babies who are basically going through withdrawal symptoms. In rats, some fetal studies have shown that there are retinal defects in the eyes, there's cleft palates, rib malformation, slowed physical growth if meth is present. Again, we talked about withdrawal symptoms. And there was a Swedish study that evaluated children at age 8 and said that there was a significant correlation between how much meth was in the system when they were in utero and the level of aggressive behavior that they have and social maladjustment. So they have problems adjusting to certain social situations, they're very aggressive, and that's directly correlated to how much meth was in their system when they were in utero. Again, we said it can cause poor growth, developmental delays, behavioral problems. And 2, it's important to know that not all children who are exposed will have symptoms. Odds are they probably will, but not every child will. Rebel, I tried to get some info on meth levels, on where to track that as they decline. Okay. I looked everywhere and I could not find anything that was worth sharing that I was comfortable in my knowledge with. I spent probably about an hour and a half just in all my resources. I couldn't find anything. So I'm sorry about that, but hopefully I think you said somebody else might be coming to talk about that soon. So they might be more of an expert on that than me. So we'll move to cocaine. Again, highly abused. People take it to get high, and it can cause behavioral problems, impaired language development in kids. It also puts them at risk for cognitive dysfunction or developmental issues. Seeing a pattern here. Some life-threatening effects on the baby could be pulmonary edema, so they have excess fluid in their lungs, which is not good if you're trying to breathe. They can have arrhythmias where their heart beats irregular, their blood pressure could be increased, they can have seizures. It can mess with the placenta, can cause preeclampsia, limb reduction. So if it's limiting the blood flow from the placenta, so the baby's not going to get enough blood flow to help their limbs to form, to help their heart to form, things like that. They can have some impaired functioning later in life. As they grow to become teenagers and adults, they can have impaired function at school, behavior, their brain structure is altered. They are more predisposed for ADHD. And teens are twice as likely to use tobacco and marijuana if they were exposed to cocaine in pregnancy. So they have trouble with problem solving, they can't control their emotions, they can't handle stress, things like that. Marijuana, again, same type. I wasn't going to put a whole nother slide with the same stuff on it. Y'all can see the trend that happens. Fetal alcohol syndrome is also another thing. If alcohol was present, 1 in 10 pregnant women report some alcohol consumption. And really, no amount of alcohol is safe in pregnancy. Breastfeeding, we can talk a little bit more about how that changes, but still, if it was my wife, probably not. But it can cause some abnormal facial characteristics, poor fine motor skills, structural changes in the brain, things like that. So that kind of wraps up our drugs of abuse session. If you were going to have treatment of any of those complications, most of it will revolve around the same things we talked about with anxiety and depression, and counseling, behavioral therapies would be how you would treat some of those complications. Lastly, here just a couple slides about some of these other disease states. I had some drugs sent to me about. So diabetes. Most children with diabetes are going to have type 1 diabetes, and that means their body doesn't make insulin. Statistics are kind of more showing that if you're a kid and you have diabetes, that's probably what it is. But there is an increasing prevalence of type 2 diabetes, which is insulin resistance. And so the way that I remembered in school, because it took a long time for me to just inherently know that, so you have type 1 and type 2. So 2 is resistance because you can make an R. So that's how I remember that. So the body's still making insulin, but its tissues aren't as sensitive to it as it used to be. So it's not going to work as well when the body does release it. A couple different ways we can, sorry about that, we can use insulin is via pen or vial. So there's a picture of the pen over here on the right. It has twist-on needles, really, really convenient. You can take it with you. Most of them don't have to be refrigerated once they're open you can leave it out for a couple weeks to a month. And there's also insulin pumps, which are used quite frequently in type 1 diabetes. In diabetes, the pancreas can't work like it should, so basically we make an external pancreas in the form of an insulin pump. And that is usually has a pod here, you can see, like a cartridge of some kind, and that's where the insulin is at. Usually that is a short-acting insulin because that's what our body has. It doesn't need a long-acting insulin in our body because it has a store of it. It can just get some whenever it wants it. And so that's what the insulin pump will be. And that is usually regulated by an endocrinologist. There are different ways that the pumps can go in the body. They have some where you change the tubing every couple of days. They have some where you put a pod like on your arm and you change that every day. So a lot of options there. If you're using insulin pens, there are short-acting pens as well, but also longer-acting pens. So longer acting, you may just take once a day and it covers you for 24 hours. But a shorter acting insulin, you might need to take it with each meal as you're consuming calories, and those calories and nutrients get converted into sugar so the body can use it. It needs insulin to help process that. And so that's why we would see that shorter acting used at mealtime. There's other medications that are oral medications. Let me back up just a second. Lantus is a common long-acting insulin. NPH is kind of medium-acting. And Lispro or like Humalog, Novolog, those types are shorter-acting insulins. Oral medications are probably less likely to be used in children. Those are mainly used for the type 2 diabetes or the resistance. So those, if you have specific questions about that, I'm happy to take them. Just let me know. Asthma is another big area in kids. I'm especially passionate about asthma because one, my wife has asthma, and two, she's a respiratory therapist, and she's a professor at Cisco in the respiratory therapy program. So I kind of live and breathe asthma just like she does. But so there's a couple things to know about asthma. There are some rescue inhalers. I threw some pictures up here. Those usually have albuterol in them or levalbuterol in them. Here's some brand names here: ProAir, Ventolin, Provenol, Xopenex. A lot of times in kids, the main reason why I wanted to mention this was there's a spacer. I don't know if you've ever seen one, but there's a picture of one up there on the right, top right. So basically it creates an extra space for the medication to be stored in to where the kiddo can inhale it properly. Because if you notice in this picture right here, that mist is coming out pretty forcefully. And a lot of times the kiddo is not going to be able to push that down and inhale at the right time. And so if we can put it in a holding chamber with some one-way valves, they can inhale it as they see fit, as is natural for them. If you don't have that and the timing's off, most of this spray goes right at the back of the throat and doesn't go down to the lungs where it needs to go. Here's a picture of some asthma airways. So they're a lot more constricted than normal. One of the main side effects with the albuterol is shakiness. It gets in there and opens everything up. Well, it can also do that throughout the rest of the body in certain areas, and that can cause some shakiness and jitteriness. Same with like nebulizers, that's going to use albuterol as well. And so there's a picture of that there. There's also maintenance inhalers like Advair, Brio, Symbicort, and that is a device here. And main counseling point there is to make sure and rinse your mouth after using them. They have a steroid in them that can kind of suppress the natural immune system in the mouth, and so it can cause thrush to form. There's also Singulair. That's a really common medication used in kids. Even if they don't have asthma, it can be used in like allergy type situations. Basically, it works on preventing that mucus to get as mucusy, as kind of as general as I can think to make it. There's also Xolair, which is a shot. That's a pretty new medication that we use to kind of suppress the immune system a little bit. That sounds bad, but it's got a lot of certain regulations and hoops you have to jump through to use it and be approved to use it, and your doctor is going to want to monitor you for it. But that's something as well. Same kind of thing with allergy shots. Not quite as cautionary as Xolair would be, but definitely want to make sure that you're doing all of those properly. There is also in kiddos some GERD, gastroesophageal reflux, heartburn. All of those terms are pretty much the same thing. Some of the medications we'll use in that are proton pump inhibitors, which in the stomach, whenever acid gets released, it's via something we call the proton pump. And so if we can stop that, the acid stops. And so Prilosec is one of those, or omeprazole. Lansoprazole or Prevacid is also another common. PPI is also what we would refer to those as. We have some antihistamines, which are not like the Claritin or Benadryl you might take. They work on a different histamine receptor in the body, and that is like famotidine or Pepcid, or ranitidine or Zantac, which is actually just recalled pretty much across the board. So if you have questions about why that happened, feel free to reach out to me. I'm happy to talk to you about that. High blood pressure can also be seen. You know, we talked about the stimulants causing an increase in blood pressure. Sometimes doctors might decide that if the patient's monitored close enough, that the side effects of that stimulant raising the blood pressure are worth the benefits that it provides. So they may put them on a blood pressure medication to help control those side effects. And certainly, we don't like to give you a medication because you're taking another medication, but in some instances that might be the case. Also, if we talked about like drugs of abuse affecting kiddos in pregnancy and things like that, there could be malformations that happen in the heart and kind of blood pressure system that cause the need for blood pressure medications. So each case would be unique there. Again, we talked about clonidine being a unique medication that can be used for kind of some behavioral stuff and also blood pressure. Some other common examples of blood pressure medication are lisinopril, losartan, metoprolol, all different classes of drugs, all work in a very specific way. Again, if you have certain questions on those, I'm happy to answer them. Lastly here, some pain and fever medications. Y'all probably all know about these. Tylenol, Motrin, Aleve. There's some allergies medications like Flonase, Nasacort that are nasal sprays. Some antihistamines. One of the best ones in kids for allergies is Claritin. Works better in kids than it does in adults. And then Allegra would kind of be my next choice. And then Zyrtec would be my last. Not that it's a bad choice, but just less preferred than Claritin is. All very good choices though. I also get some questions about constipation in kids. Main thing we want to be careful with is their fiber intake. Make sure they're getting adequate fiber intake because most kids don't like to eat their fruits and vegetables that have lots of fiber in them. They like to eat sugary things that don't have fiber in them. So if they're experiencing constipation, want to make sure that fiber intake is good. Good roundabout goal is 30 milligrams or 30 grams a day of fiber, and that's on the nutrition label. And then proper fluid intake as well. That will help a lot with constipation. Prune juice is also really good. I know people like my grandparents swore by that. Well, there was a reason. And it's a really neat way on how it works, but it works really, really well relatively quickly within a day or two. So that's, grandma was right about that. Here's a slide about just some good resources as we wrap up here. The CDC, basically, they have lots of great information on ADHD and depression and anxiety. So I encourage you, if you have more questions, you can certainly reach out to me, but they have great, just real easy to read resources on their websites. A lot of questions I get are about, if I have medications that I need to get rid of, what should I do with them? Number one, do not flush them down the toilet, please. Our wastewater people would probably really love you if you would not do that. Please don't throw them in the trash either, because that also ends up in the water supply. But medicationcleanout.com, that is a service provided by the pharmacy school and the Poison Control Center here in Abilene, Amarillo, Lubbock. Twice a year, they have this event at the pharmacy school. You drive up, throw them your medications in a bag, and drive off. They incinerate them. So great service. And some pharmacies also have drop-off boxes too that you can take them to and dispose of them there. Of course, since we talked about depression and anxiety, National Suicide Prevention Hotline. I'm sure you guys are well trained in how to access all this stuff. I did not know they had a text feature now, so that's pretty cool. Text hello to this number, and so I felt like that was really great, especially for like teenagers and stuff, since they're texting all the time. That's a great option as well. And of course, poison control, that's a great number to have on hand too. Does anybody have any questions for me? I know we're kind of close on time, but I'm happy to stay as long as y'all want me to stay.
So before we get to the questions, Jordan, I know there are a few people that have other Zoom meetings, and Jane already had to jump out real quick. So I'm going to do the 2-door prizes real quick, and then people that want to stay on can stay on. They can ask their questions. You can go ahead and put them in chat if you have to. And Jordan, I'm not sure how much time you have, but
Got about 30 minutes left, so
okay.
All right. Good.
Well, if you'll pick a number between 1 and 15 for me.
3.
Number 3, Anita Broxson. This is for you. You get one of these. And then another number between 1 and 15.
I'm going to go with 12.
Penny Terrell. Miss Penny, you get one. So Anita and Penny, I will get these out to you guys, okay? All right, so what I'm going to do, if you need to go, then you are free to go. I've got your name down here. I've got you signed in, so you're good to go. And Jordan's information is on the screen here, so feel free to take a screenshot of that or take a picture of the screen so you'll have his information. Please be very respectful of their time. And I think he prefers probably that you give him an email, and in that way maybe he can respond better or set up a time to visit. But just be respectful of their time. Don't bombard with, try to combine all your questions into one email and that kind of thing. Jordan, we appreciate you so very much. Thank you for coming and participating. It was very informative. And what questions do you guys have? If you need to go, you're free to go. If you have questions, you're welcome to stay.
Thank y'all for having me, first off. And then, of course, yeah, my email's there, phone number's there, 2 locations. I'm always at one of them, so you can find me wherever if you have questions. Happy to help any way I can.
Great. Thank you. Okay, guys, any questions at all?
This is Anita. I just put a comment on there because I notice kids will run. I have a daughter who has asthma. She's an adult now, but I once had to teach a group of elementary school children about asthma when I was a nursing student. And one of the tricks I learned to do with them, because the nurse complained that they were always running out of medication. They would come and get their, inhaler, and it would be almost empty. If you take the little cylinder out of the chamber, out of what you hold to put in your mouth to take it, take that little cylinder out and put it in like a little tub of water. And if it's full, it's going to float horizontally. But the more vertical that becomes, the less medication is in that cylinder. And we did a lot of just random tests with the children's inhalers at the school, and more than half of them were almost empty, but they had no idea.
Okay.
And if a child isn't responding to that medication, it could get very serious.
Yes.
Absolutely. And that's a great trick.
I had to share that.
Yes, I'm glad you did. That is a great trick. Yeah, you just, the little, I can go back here and find the slide, but in the kind of L-shaped thing, yeah, the plastic piece has a metal canister in it. You just take it out and it's got like a little nub on the end where the medication sprays out. If you just float that in water, yeah, and it will. Some of them have dose counters on them now. Those can be unreliable sometimes, but if you need a ballpark and it doesn't have a dose counter on it, then that is for sure a great way to do it. Sometimes even the dose counter will register a spray if a spray wasn't done, if it just had a little bit of pressure on it. So yeah, that's a great tip.
Okay, other questions? Does anybody have anything? If you're trying to talk and you're muted, you'll have to unmute or text me in the message box and I can unmute. Deborah, are you trying to talk? Yes, okay.
Mm-hmm.
There you go.
Where on South 14th is his pharmacy?
It is right across the street from Hobby Lobby. There is a Leslie's Pool Supply there, and we are the freestanding building. We have a Bank of America ATM on the back side of us, but yeah, right across from Hobby Lobby, and Schlotsky's all right there on South 14th.
It's right, Frenchman's Creek runs right beside it.
Yes, ma'am.
Thank you.
You're welcome. Other questions?
I just wrote one in. What's the lowest dose of Celexa for a child? I had a child, they dosed, she was on 5 milligrams and they dropped her to 2.5. Is that the lowest it goes? Or if the 2.5 isn't alleviating the symptoms that she had, the side effects, a better alternative to the Celexa?
Yeah, so yeah, 2.5 is probably as low as you could go with a tablet without like halving it or quartering it. Some other options might be like escitalopram, which is Lexapro. That might be another option. That would be my first one that I would jump to. Would be that, just because it's similar but still a little different. And from my experience in dealing especially with kids, the prescriber has a lot of experience with that, and they kind of have their defaults that they would jump to next versus say another prescriber. So I definitely mention that to whoever prescribed that, because they may have a more preferred alternative than I would.
Thank you.
Yes, ma'am.
Jordan, I have one more thing real quick. We have so many parents that are, they have to do drug screens before they can have visits, before hearings. It's just a normal part of their routine. And explain how Adderall can be a problem when they're doing their drug screens.
That's a great question. So Adderall is an amphetamine, and we also talked about methamphetamine. And so, again, Adderall can be abused, and not necessarily that like the kids that take it would become addicted to it. That's certainly not the case. But if you don't necessarily have ADHD, you could become addicted to it. But yeah, so since it's amphetamine that is Adderall, and you have methamphetamine, the structure of that molecule is very, very similar. Mm-hmm. And so a lot of the tests that are out there look for a specific structure. And if there's any way that structure kind of reacts, then it's going to show a positive test. Mm-hmm. And so the main thing, if the parent or patient knows that they're taking an Adderall type prescription, I would recommend that they have those records handy. Yes. If they are going to have a drug screen, because I can almost guarantee that it'll show up.
Yes, and the one thing I know that they do ask, if it shows up, they can't just say, well, I'm on Adderall. They have to actually provide a prescription in their name. And I think one of the things that we have to be aware of is that often the parents will, if they have an addiction problem, take the child's medication. And so the child may not be getting the medication that they need desperately.
Right.
So that's something to watch for.
And that's exactly right. Yeah. So if they can't just say, well, I take this, I have a prescription for this. Yeah. It's best like if they were to bring the bottle or some sort of record from the pharmacy or doctor's office or something, because then it's 100% proof. And it also has to be a recent prescription. It can't be like, oh, I had a prescription for it in August and now we're in, April. It has to be recent because it only stays in the system so long. One thing, hair is a very, very long period of time sample. So as the hair grows slowly versus like blood or urine, that gets refreshed pretty often. And so that's why a lot of times we like to do a hair follicle test to see if there's any history, 6 months or so. But anyway, so yes, it's certainly an issue when parents take kids' medications, and it doesn't have to be a controlled substance. It doesn't have to be Adderall for them to want to abuse it. We've seen people that take clonidine, like we mentioned. It can be used for blood pressure. It can also help with sleep. And so we've seen parents sometimes the kiddo will have a prescription for clonidine, and the parent's always like, well, can they get their clonidine filled? Well, they're almost out. I'm like, well, they shouldn't be out. They should still have a week. But it turns out that sometimes parents take it because it does provide an immense calming effect. So I don't want to say it's just like Xanax or something, but it would be similar. And so I was actually talking with one of our technicians the other day. I said, I was putting up some clonidine on the shelf, and I was like, it's just a matter of time before this becomes a controlled substance. Maybe not anytime soon, but 10, 20 years down the road, very well could, because of those type issues.
All right, guys, any other questions before we let Jordan go? If not, Jordan, we appreciate you. You guys wave, give him a thumbs up, a thank you, and we appreciate you very much, guys. So you are free to go.
Thanks, Jordan. Thanks, Rebel.
Thank you, guys.
Thanks,
okay, I'm going to end the meeting.